There are some reports that we're getting of people having to wait when they're trying to get access to the Pfizer vaccine if they're eligible. Is there an issue with Pfizer supply at the moment in Victoria?
So in general, there is a constrained supply of Pfizer vaccines. If we had more, then we would be able to give more. But you know, there's a supply chain. It comes from the Commonwealth, and in turn, that comes from overseas. And we are making do with what we've got at the moment.
Is there a supply shortage in Victoria? Been talking about active diversions. Can you just explain to the Victorians listening to this what that actually means? Because they're probably tossing up whether they do walk up as advertised by the government the other day. Like, how do they avoid that confusion when walking up for the vaccine if they're staying aged care workers?
So if they're an worker, they get priority. So they've got to bring their, their ID card to show that they're an aged care worker or disability care worker. But there's a special line for them. For the active diversions, I think there's basically management to say, look, this line's looking really long, but we know that there's a site down the road that has a shorter queue. You might want to go there.
Do they go to the front of the queue at the site that they're actively diverted to?
Not that I'm aware of, but yeah.
With the Pfizer vaccine and with your role at Target, other states are providing Pfizer to over 50s. Victoria seems a bit of a shortage. Does there need to be a national approach to setting guidelines on how Pfizer's rolled out?
Yeah. There are always times where Pfizer, for practical reasons, Pfizer's given to people over the age of 50. Probably the easiest example is in a remote community. You don't want to go in with two different vaccines, and you certainly don't want to, make mistakes or anything. So in those situations, it's certainly appropriate for one vaccine to be used for the whole population in those sort of areas.
Calling the hotline, the vaccine hotline today, have been told that there's no Pfizer left. Is that incorrect information?
We are still vaccinating at the moment. I think in terms of forward bookings, there's a shortage, but I'm not sure exactly when that supply will become available. And we're trying to do the best we can with the supply that we have.
Will you ask other states to give us some of their Pfizer? So that 49-year-old cohort?
Oh, look, I think we'd always welcome any state that would like to give some of their vaccine to us, but I think that's a matter for our national government.
How short are we?
So we are delivering. So there is a small stockpile, and we're using those at the moment. I couldn't give you the exact figures, but clearly there's. Be able to meet that.
Give enough to make sure that people who have received their first dose of Pfizer get their second dose in 3 weeks' time.
Yes, I understand there is. So I'm not across the entire the exact numbers, but we do get some forward predictions on what the supply will come. Obviously, that's dependent on the supply coming in from overseas as well. But we do get a forward prediction, and then we obviously try and put stock aside to make sure that there's enough for second doses and so on.